A patient in Arizona has died of bubonic plague, according to multiple reports. A Northern Arizona healthcare spokesperson says the unidentified patient arrived at the Flagstaff Medical Center ER and passed away the same day. Known for causing the Black Death that swept through Europe and Asia in the 12th century, bubonic plague is caused by bacteria known as Yersinia pestis. It impacts humans and other mammals. People usually contract the disease through a bite from an infected rodent, flea, or touching an animal carrying the plague, according to the CDC. Health officials say they made attempts to save the patient's life but were unsuccessful. They say they discovered the person had bubonic plague through a rapid diagnostic test. Local, state, and county officials are investigating how and where the patient contracted the disease. County health officials recently reported a mass prairie dog die-off just northeast of Flagstaff, which they say may be an indicator of the plague. Investigators are now working with the owner of the privately owned land where the prairie dogs died to gather flea samples and test them for bubonic plague. Health officials warn anyone who believes they may have a contagious disease to contact their doctor or, if severe, go to the ER. They say people with potentially contagious illnesses should wear masks when arriving at the hospital to prevent the spread. Bubonic plague infections in the U.S. are rare, but not unheard of. The CDC says there are some cases in the U.S. as well as Africa and Asia each year. The agency reports an average of 7 cases annually in the U.S. Those cases are not always deadly and can be easily cured by antibiotics if caught early enough. Symptoms of bubonic plague usually develop within 2 to 6 days after infection. They include fever, swollen and sore lymph nodes, most common in the armpit, groin, and neck. For more on this story, download the Straight Arrow News app or visit san.com. For Straight Arrow News, I'm Kaylee Carey.